Hello, my name is Margarita Terressa. I practice general obstetrics and gynecology. I have been in private practice since 2002. I did my medical training at Ponce School of Medicine and then completed my OBGYN residency at Tulane University. I started my career as an assistant professor at the University of Louisville, where I taught for 5 years. Then I joined Women's First, where I have developed a private practice with concentration in minimally invasive surgery and adolescent gynecology. Is abdominal hysterectomy my only choice? Abdominal hysterectomy is no longer the only choice for a hysterectomy these days. Today, the majority of hysterectomy procedures can be performed with one of the minimally invasive techniques, which include vaginal, laparoscopic, and robotic assisted. Despite the fact that many surgeons have become proficient in the less invasive surgeries, traditional abdominal hysterectomies remains the most common approach for women in nearly all countries worldwide. The reason for this is the steep learning curve, the operating room cost, and the lack of teaching programs in minimally invasive surgery. With the advance of laparoscopy and minimally invasive surgery, hysterectomies are currently performed using the less invasive procedure to achieve the quickest recovery with the less complications. I would like to see a minimally invasive option offered to the majority of women. Am I a candidate for vaginal hysterectomy? You're a candidate for vaginal hysterectomies if no intra-abdominal access is necessary, if you have uterine prolapse and/or a history of vaginal birth that might allow better access for the vaginal surgery. To achieve a good vaginal hysterectomy, the patient's ovaries should be of normal size and anatomy. If evaluation of the ovaries is necessary, then laparoscopy will be helpful. Ovaries can be removed at the time of a hysterectomy, that is performed vaginally, but it's preferred that they are free of adhesions and disease. Am I a candidate for laparoscopic hysterectomy? Currently, because of the advances of electrosurgical devices and other instruments such as uterine manipulators, laparoscopic hysterectomy has become a standardized and reproducible surgical procedure. For this reason, all hysterectomies should try to be approached laparoscopically. Many studies have shown that laparoscopic surgery has a lower complication rate than abdominal surgery. Past surgical history, patient's body mass index, and patient's medical history are key components when deciding what type of hysterectomy you should have. Other important components are the size, mobility, and distribution of the uterine tissue. Am I a candidate for robotic hysterectomy? Many of the indications for laparoscopic surgery are applicable to robotic surgery. Robotic surgery has been helpful to me in doing cases for patients who have previous surgeries, since they have a higher risk for scar tissue. For example, having multiple cesarean sections can create scar tissue between the bladder and the uterus. A plane between these two structures need to be developed in order to remove the uterus. When there is a large amount of scar tissue in these areas, the Da Vinci robotic system has helped me to create the planes in a delicate fashion and prevent injury to the bladder. How do I decide what type of hysterectomy is best for me? The best hysterectomy choice is based on the information explained before. Surgeon's expertise is a critical component for a successful surgery. When evaluating a patient for a hysterectomy, a surgeon should take many things into account. It is a combination of the surgeon's expertise and the surgical candidate. The bottom line, if the only choice that you're given for your hysterectomy is a large abdominal incision, you should seek a second opinion, because like we have said before, that is not the only way to do a hysterectomy. Nowadays, you really should have a small incision for your hysterectomy.